NAThe Tories found that Scotland's air departments dealt with increased numbers around Christmas. First Minister Nicola Sturgeon was forced to apologise to patients this week as accident and emergency waiting times soared to the worst level since reporting began almost 3 years ago. She said, "We have seen exceptional pressures this winter, largely due to the increase in flu cases but also, particularly in the period immediately before Christmas, weather-related pressures." Health Secretary Shona Robison also blamed winter pressures for the very challenging figures, which showed only 78% of air patients were seen within 4 hours in the week before Hogmanay. But research by the Scottish Conservatives has found the country's casualty units were, in fact, busier in both May and June last year than they were in December. The party is now calling for the SNP government to take full responsibility for NHS performance rather than looking for excuses. Shadow Health Secretary Miles Briggs said, "These figures show clearly there were more people coming through hospital doors in the height of summer than the depths of winter. That renders many of the SNP's excuses made in recent weeks utterly false. The Nationalists must take full responsibility for the dire situation in casualty departments." The Tories found that Scotland's air departments dealt with 107,328 patients in the 4 full weeks recorded during December, compared to 109,942 in the equivalent period in May and 108,420 in June. Despite the extra patients in late spring and early summer, waiting time performance against the 4-hour target did not dip below 92% in either month. Meanwhile, the British Medical Association (BMA) in Scotland said the NHS was in need of additional funding. BMA Scotland Chair Dr. Peter Benny said, "Instead of gratitude, we need a long-term, sustainable plan that closes the growing gap between resources, in particular finances, and the demand for services. And we must not simply dismiss this as the inevitable increase in pressure that winter brings." Last November, the Royal College of Emergency Medicine Scotland said the annual summer peak in air attendances was caused by better weather encouraging outdoor pursuits. Vice President Dr. David Chung said most summer injuries could be treated quickly while the delays in winter were typically caused by a shortage of beds. He said, "The flow of patients downstream has more of an effect on the 4-hour target than sheer volume of numbers." Sunday, April 9, 2017. Men, the color of the tie is the most difficult decision they have to make every day. It's the exit block effect. So in winter, you may have more older people coming into air who require admission into a ward, but you can't get them there because there's no spare beds. A Scottish government spokesman said emergency departments saw the highest level of attendances over the festive period in a number of years. During the 12-week festive period, attendances were up 10% compared to the previous year, with a 20% rise in the week up to Christmas. Hospital teams are ensuring that patients with flu are either cared for in single rooms or in wards with other patients with the same type of flu to avoid cross-contamination. However, this results in extra cleaning and administration. It can mean that treatment can take longer than normal in air and assessment units. The big increase in flu cases, which doubled in December compared to last year, and patients with complex care needs, has contributed to significant pressure on air departments as clinicians focus on delivering the best treatment.